I've had type 1 diabetes for most of my life. I've seen insurance companies, prescription prices, medical bills, pharmacies, and healthcare bureaucracy from a perspective most people never have to. And after years of dealing with it, I don't think the American healthcare system is even broken. I think it's working exactly as it was designed. But I wasn't really caught up with the real intimacy of how the healthcare system really works until I was diagnosed. I started off with having to go with different sort of therapists to deal with mental issues and depression and anxiety like most people have in the past. And normally people just take a medicine like Zoloft or some sort of other pill to fix those issues or at least suppress them at the time. Now, after taking those and not realizing that it wasn't actually helping me, I quit and started smoking weed. And that eventually wasn't doing anything for me either. It only came after doing blood work that I actually realized, and after being hospitalized while on another type of drug that I can't really bring up right here, but I actually saw that I was diabetic. I was diagnosed inside of the ER hospital, and I had no idea how the healthcare system was going to keep me protected or at least keep me sane. And it took a lot of time and learning for me to actually learn how to work around and find the words to use to be able to explain what help I needed and what I needed at the time. And when it comes to insurance, I had no understanding how actually in depth it can really get. The medication costs were surreal without any sort of coverage, and doctor visits always have some sort of minimum base pay that I didn't realize until I started going to them on my own and realizing that I had to pay for these things. It wasn't just some magical free healthcare system that I thought it was as I was growing up. And the administrative complexity of it goes further beyond what I could have possibly imagined. It goes from one person to another to another to another. It's like a train of people of context that has to get through. And if you've ever played the game Telephone as a kid, when you tell one person one thing and it goes through 15 other people, it ends up not sounding like or even close to the complexity of your sentence, even if it was something simple. And that's something that I had to realize. When you have a chronic condition or a disease, you start realizing how many middlemen actually exist between you and your treatment. When it comes to the way that I was diagnosed, I had no understanding of what was going on with my mind or my body, and neither did anyone around me. I didn't realize that I would have to learn about things like the nutrition I'd be ingesting, the chronic disease that I was diagnosed with, or even what the lifestyle education would have been to changing all of my day-to-day habits and options and choices that I made constantly until I started actually becoming more in education of what was going on with my body. But one of the issues that I learned as I was figuring things out with myself is that majority of the time we spend enormous amounts of treating diseases much rather than finding ways to prevent it entirely. And that's why we've hit high numbers, and especially the US, of obesity and diabetes, like myself, such as different things, even as far as heart conditions and cardiovascular diseases that still are fighting issues that we're constantly dealing with today. And none of this stuff comes at a low cost whatsoever. I mean, even with my own supplies such as insulin, sensors, or having to deal with all the insurance headaches that I've had to fight with over the years, is constantly a stress that I can never live down. I'm having to call 13 different people just to get one answer so that I can go and spend a few $100s on an insulin that's only going to last me maybe a month, and I have to do it all again the next month. It's an exhausting experiment that I have to constantly go through, especially with these insurance companies fighting to basically not pay anything. They don't necessarily want to take care of people. What they're looking for is a new bag to pick up so that they can continue making the most amount of money that they've made in record years. And with it being one of the biggest years every single year for them, that means that the money's coming from somewhere, and it's from us. We're all footing the bill. If you get sick, that could cost you a lifetime worth of work and money that you're never going to live down. Even just in the US alone for the past year of 2026, we have scaled the debt to over $220 billion, and it's the largest category of consumer debt in the United States, surpassing credit cards, utilities, and even other consumer loans. And that goes as far as places like buying rent at an apartment or a home, or even a car loan. These are no expenses that just go without an open eye. About 14 million adults, which is roughly 6% of the population, owe over $1,000 in medical debt. And so many people are more than just that to be affected. These are just numbers that have been allocated for so far. This doesn't go for all the people that haven't actually spoken up or had any sort of consensus put into this research. From what I've learned off of footing the bill on my own and other people's stories, this is one of the most expensive payouts that you could possibly have within your lifetime ever. Not your home loan, not a super nice supercar, but literally just your medical health. That's the most expensive bill. And from what I know, the American healthcare system has completely faltered people's financial systems. Just being sick can cause a huge dent inside of your financial profile, but continually being sick can be egregiously expensive to the point that you literally have to file for bankruptcy. And that's one of the number one causes for bankruptcy in America, and that's medical debt. And that goes as far as people not even going to get the proper care that they need because of how expensive it is. And that's not how we should be living. We should be looking for, in a first world country, the healthiest lifestyles that we can and maintaining those ways since we have the most availability to that in our world. But unfortunately, one of the biggest incentives for the American healthcare system is keeping people sick. When profit, bureaucracy, insurance, healthcare providers, and patients all have different incentives, things become incredibly complicated. And in healthcare, everything seems to be like you're navigating some sort of maze, or you have to know the certain keywords or notation so that you can get a hold of the people that you actually need to talk to. Majority of these insurance companies even use AI automated filters so that you have to say a certain keyword so that you can actually even talk through to a person. One thing that I've learned with a lot of these phone calls, though, is that they're pretty easy to get through when you know what to say. Like, I need to speak with an operator or put me online with an agent. But unfortunately, not everyone understands this. I mean, imagine your 60, 70-year-old grandma trying to get a hold of her insurance company because she just needs her dietary medical pill or SRIs so that she can take care of her GI system. It's insane. We shouldn't have to fight an automated system just to be able to talk to a person that can actually help us. And that's all everyone's looking for, is just some help to be able to stop feeling sick or stop feeling the way that they are so they can get to a better day-to-day. And unfortunately, the entire system is entirely too reactive and not proactive. We're not constantly pushing things out, like trying to stop these things or trying to prevent them entirely by, going to the gym or maintaining healthy lifestyles. Majority of the time, it's just fighting what's already occurred, and there's nothing you can really do to reverse any of these things. It's just living with it, learning from it, and trying to continue going on with it in your back pocket. And unfortunately, living a healthy life in this country or in any sort of place of stay is not necessarily cheap. A lot of it is way too expensive to continue doing. And that's why there's McDonald's all over the place. It's super cheap and it's something that's constantly available. But that's the worst part, is availability. You're available to continue making yourself sick or continue making your body feel worse, but it's less available to actually do the right thing, such as take care, buy organic or fresh foods and vegetables, and do things that are right for your body. That's why there aren't gyms next to every McDonald's. It's not something that's made out for the people that are actually going and trying to do something better for themselves. It's made out so that you can continue doing something that is going to put money in the insurance's pockets. That's why there are so many things that are unhealthy and available in this world. But being healthy isn't always going to be the profitable idea for all of these places. And that's why they continue pushing out these advertisements of strawberry Sprite and Coca-Cola, French fries dipped in batter and oil that are going to just make your stomach degrade itself. And that's why we need to constantly be making the right change and the right decisions to do better for ourselves and our bodies, because that's all you really have is your own health. When everything else fails, that's the one thing you want to lean on that you know you can trust. And whenever you do the right things for your body, you actually have a future built in so that you are constantly going to be able to fall back on. But what would be your biggest frustration with the healthcare system? Is it insurance, costs, wait times, prescriptions, or something else? Let me know in the comments, leave a like and subscribe, and I will catch you guys in the next one.